I think excellence is hard for me to define, but I think it's more I know it when I see it.
Excellence is in our doctors, our nurses, our staff.
Excellence is patient-centered care.
Providing a high quality of service for all of the residents of the community.
Excellence is just doing those little things extra that anyone can do to make things better for the patient.
Consistent, superb service.
Excellence is people doing what's best for the organization.
Going above and beyond, and always trying to stay ahead of the curve.
Excellence to me is striving for perfection but not quite getting there, but always going for it.
Excellence would be more than just providing the care you need and meeting the needs of those patients. It's anticipating what other needs are out there.
I think of a group working together for one cause. That's quality patient care.
I really haven't seen the level of care at any other facility that we've lived that I have in Milford.
Yeah, from everyone that you deal with, from the first person that you come in contact with in the door, through the doctors and nurses, and it's just unparalleled, I think, to anything that we've experienced.
When one of your family members needs emergent care or intensive care, it's much easier to know that you can get that in your backyard as opposed to having to travel an hour.
It's important for my family, and I think for everyone in the community, to have an outstanding hospital in the immediate vicinity.
The first thing that comes to mind for the new building is the ability to keep my family safe. It's the ability to meet the needs of my growing family on a long-term basis. I want them to be able to access health care locally when they need it.
What excites me the most about this new building project is the ability to accommodate 70,000 patients on an annual basis in our state-of-the-art emergency room.
I know the building project is going to bring lots of wonderful things to the Milford community, but I have to say that I'm most excited about the private patient rooms.
To set aside an area like the Healing Garden, to have a place where the families can go and just sit and think about what is likely a very difficult, trying time in their lives is important.
One of the important parts of this new facility will be the ICU. Milford Regional Medical Center will be able to meet the medical needs of far more people who normally would have to go elsewhere.
I've been through the ED more times than I'd like to admit, and I have seen what the physical constraints do to the service, and I'm really excited to see the expansion of that to accommodate the increased flow of people who will be coming through the medical center.
It's an incredibly caring institution. It not only delivers, sort of a high tech that you may not expect in a community hospital, but certainly that sort of trite expression, high touch.
The only way you can remain a community hospital is for the community to get behind the institution to help support it.
The hospital is an integral part of people giving and stepping up. I mean, not just, again, the financial commitment, but people volunteering their time.
We want this to be the top place to go for health care, and we want to be able to have our families, our friends, come to this facility, and we want to make this the best place to possibly come.
I feel it's very important that the hospital continue what it's doing forever and ever. If there's such a thing, it's not a story where it's that everyone lives happily ever after. But we've been here over 100 years. Can we do it another 100 years? Sure, we can. It's something that's very important, and I hope to pass this legacy on to my children and hopefully their children. We'll be long gone, but this institution will be here.
Why not support something that, number one, you believe in, number two, you get a great benefit, and number three, is part of your legacy. And Milford Regional is part of the Milford legacy.
We need to be there to continue to support this hospital now and in the future.
Our success in the future here locally is tied to the hospital, and the hospital's future is tied to us. It's a bond, it's a partnership, and why wouldn't you invest in that partnership?
I've been with Milford Regional for almost 31 years, and I'm really, really proud of that. People along the years have said to me, why do you stay? And I kind of look at them and just go, why would I leave?